Okay, well, welcome to another of our conversations with pathologists. I'm Dr. Louis Hassel, and we're speaking today with Dr. Sanam Husain, who is an associate pathologist at Henry Ford Hospital in Michigan. We're really pleased to be able to reconnect. We've known each other for quite a number of years. Worked together for part of that time, and I'm just anxious to hear some of your thoughts about how your career is developing. Sanam, why don't you introduce yourself and tell us a little bit about your background and where you are?
Sure. Thank you for having me, Dr. Hassel. It is a privilege to be here, and it's always nice to chat with you. So I am a surgical pathologist. I'm currently at the Henry Ford Health System in Detroit, Michigan, where I'm a senior pathologist. I trained at the University of Oklahoma, and Dr. Hassel was one of my attending mentors. And that's where I completed my anatomic and clinical pathology training. After that, I did a year of gynecologic pathology and followed that with a surgical pathology fellowship. After completing my training, I stayed at the University of Oklahoma, and I focused on the areas of surgical paths, which were primarily gynecologic paths, breast pathology, and GI and liver pathology. And that's where my career began, and I was there until last year, and relocated to Michigan last year.
So, during the course of that time, I know some of the people you've worked with, but tell us about some of your experiences in terms of the kind of people and interactions you've had, doing SurgPath in an academic center like that.
So I think one of the most interesting aspects of my job as a surgical pathologist is the interactions with the clinical colleagues, which is a very broad and diverse group of people, and it ranges from surgeons, general surgeons, surgeons who do surgical oncology, like focusing on gastrointestinal diseases, gynecologic, oncologic surgeons, breast surgeons. I also have worked with transplant hepatologists and transplant surgeons in Oklahoma, and I continue to do that here. So it's really a very rewarding experience because I feel I'm very integrated into the clinical team. And unlike the stereotype of the pathologist where, we're considered that we have no social interaction, we have no interaction with anyone outside of our specialty, every day we're interacting with our clinical colleagues and helping make a difference in the management of patients. So, and that can vary, like in an academic center or academic setting, you can focus on one or two areas, but you're in a more general setting, then you would also be dealing with, for example, neurosurgeons or pediatric nephrologists or pediatric surgeons, because you have such a broad case mix. So I think that interaction is very important to me every day. It helps me keep me engaged in the patient management process, and gives me the feeling that I'm very involved, whereas people think that this is not a clinically oriented field.
Yeah, so when you were here, you would be going to sometimes 2 tumor boards a week and maybe a liver conference with hepatologists and transplant surgeons and so forth. And all of those are quite different people. Plus you have the broad spectrum of people in your own department, which was 25, 30 people in our department here. How many other pathologists are you working with in your current setting?
So this is a large group. We're about 47 pathologists here, out of which there's about 10 that are at peripheral sites, but at the main campus in Detroit, we have at least, I would say, 35 people on a given day. So as you mentioned, there's this constant interaction with our own colleagues within the department, discussing cases and showing cases at consensus conference where all the consultants get together to confirm first-time malignant diagnoses, as well as share difficult cases, interesting cases. And then we go to tumor boards routinely, where as a pathologist, you play a very key role in providing the data that is required for optimal patient care.
So, one thing that I hadn't realized before I started in pathology was how much you learn from your colleagues. But not just in a teaching hospital, but in any situation, if you have good colleagues, you learn from them. I can think of things that you've taught me, but I'm sure that there are many, many things that now in a group as diverse as yours that you're constantly learning from other peers in your department. Is that not right?
Exactly, and I think that's a very good point. I think pathology is a field in which we learn from our colleagues and our trainees literally every day, because the work that we do, you just can't do in isolation. And with the increasing complexity of cases, the requirements that, like for example, CAP has or AJCC has for us in terms of rendering past diagnoses and completing reports, requires a lot of interaction with our colleagues, and it really sparks intellectual curiosity as well as you learn from each other. And it's fascinating because you could be looking at the same slide and your colleague will have a different opinion than yours. and that's why we have consensus, and you may not agree. So I think I learn from my colleagues every day and from residents every day.
So what do you think are the biggest challenges that you find in your day-to-day practice these days?
So I think the most challenging aspect of my day is the day that I'm on frozen sections. I think that no matter how much experience you get, you're always you can encounter frozens that make you sweat and make you pause, and you have to sometimes get a second opinion. So I think that's the most challenging part of my days when I'm doing a frozen section, which means that we have to give a diagnosis within 20 minutes from the time that the specimen is received to the time that I call the surgeon back with my result, and I have to be right every single time. And so that requires a lot of thinking on your feet, because there's big decisions that are made based on that diagnosis. So I think that's the most challenging part of my day. Otherwise, I think we always come across cases that are new. We come across patterns that are new or are not familiar, and I think that's one of the reasons why pathologists never get bored, because you'll always come across something that you've never seen before. So difficult cases or complex malignant cases where staging might be not very straightforward, those are cases that are most challenging or require you to really spend time on the case, which is good, because I think as pathologists we have the luxury to spend time required for the patient's best diagnosis and best staging. So those that, along with you couple that with teaching, which I love teaching at the scope and teaching residents. So kind of building that balance between teaching and keeping the service going is something that you kind of have to improve and work on every day. And some days are easier than others. Some cases are easier than others. So you never get bored.
Yeah, I remember as we talked with one of our colleagues, Dr. Gillies, many times we would comment on the unusual nature of cases that we were seeing. And of course, as a medical student, you're always taught, well, think the common things first.
Right.
If you're always hearing hoofbeats, you should be thinking horses. But as we used to joke with one another, when you're living in the zoo, there aren't very many horses. There are more zebras and rhinoceri and so forth. Do you find that? I mean,
Yeah.
you mentioned the unusual cases. You must see plenty of those sorts of things in your current practice.
Exactly. And actually, I just before this call, there's a case I had been working on which was extremely unusual, and I had to send it to a memorial to get an expert opinion. So, because we showed it around and no one had seen anything like it, and even the pathologists at Memorial, it took them like over a week to come up with a final diagnosis. So I think as the practice is evolving, and even though some things get easier, there's other new patterns that are evolving, and with the use of immunohistochemical stains and even with molecular testing, we're just getting so detail oriented, which is a good thing for patient care, that putting it all together sometimes just takes a lot of time and thought and effort, and it's a team effort.
Yeah, it really is. So with all of these challenges and the workload that you've got, do you still have time for life outside of pathology? What is your day like?
So my day, on a given day, I start work like I would say between 7:30 and 8 o'clock, and most days work till 5:30, 6. So which sounds like a long day, but it really isn't because it goes by very fast. But depending on the case mix that you have for the day, which is not in our control, you don't know what's in your stack of slides. I think on a given day you work 8 hours a day, but some days you could be done in 7 hours, or sometimes it may take you 10 hours to do the work. And so I think it's a lifestyle that really is good for a work-life balance. I have 2 children and my husband, and I'm able to spend time with them. Now my kids are older, but they were much younger when I started practicing, and I was able to be part of their lives and see them grow up. And even now that they're at different stages, I have time to spend time with them, and there's opportunities to focus on your hobbies, for example, travel and such, because the call schedule is typically not bad for a pathologist in most places. I think most places do like a week of call, and like here I take a call like every 10 to 12 weeks. So that's not bad at all. And call in and of itself is not bad, because it could be entirely, nothing going on and quiet, or you may be called at 2 a.m. for a frozen, which doesn't happen too frequently. So I think it's a lifestyle that you enjoy. So you enjoy your work and you enjoy your time outside of work.
So are you taking any digital path calls with any of your call settings? I was speaking with others who've taken some of those remote frozen sections via digital pathology. How about you?
We have not done that as for primary sign out, but with the current situation, our consensus conference is done via Skype. So that's very helpful, because even, if when we're next door, but we can't congregate in our multi-head scope, so we're doing a consensus conference, and it's easy to share cases. You just, put the slide on, turn on your camera, and then you can share your screen. A couple of weeks ago, I was at a peripheral site, and I needed, second opinions and or confirmation of malignancies, and I was able to do that with no issues. So I think that's the way. Actually, the other thing was I did some Skype teaching with the residents, which they liked. So I was just, showing like my breast needle core biopsies for the day, and have a discussion with them during the springtime. So I think we are utilizing some form of digital path in that manner.
Yeah, great. Well, so how would you put it all together? What really makes pathology worthwhile? What would make you want to choose this specialty again?
I think that pathology is it's a very dynamic field, and it's a branch of medicine that offers the best combination of patient service, teaching, learning, and research. And we discuss service and teaching and learning from colleagues and trainees, and also like there's ample opportunities to explore diseases further and contribute towards better patient care. I have to say that when I started, giving up the stethoscope for the microscope was not an easy decision, but it's one that I have not regretted.
Yeah, I think I think there are enormously fulfilling moments in pathology when you make a diagnosis that really makes a difference for someone, or you solve a vexing problem that maybe the patient's seen multiple doctors about, or whatever it may be, that can really be, even though you're not right at the bedside with them, they can be enormously gratifying. And so
Exactly.
yeah. Well, so I'm hopeful that a number of medical students will listen to your thoughts and experiences. What advice and counsel would you give to the medical school class of this year as they put on their white coats and prepare to transition to long coats?
I would recommend signing up for a pathology rotation because even if medical students don't choose pathology as a career, I think it's very important to know what a pathologist does, and that will help them in whatever field they go to. But if they choose to stay in pathology, that would be great.
Yeah, I think there's a lot to be said for exploring it. And the nice thing about pathology is that there's so many different niches that really a whole host of personality types and avocations and skill sets can be very comfortable and find a very challenging but also fulfilling role in pathology.
Exactly. Yep. Yeah.
Well, Sanam, do you have any further final thoughts you want to share before we kind of wrap this up?
No, I think that's it. I think it's a really rewarding field to be in as a physician. Again, it's breaking that stereotype that pathologists don't have any clinical interactions or don't play a role in the life of a patient. And like I said earlier, that was my concern when I was going into pathology, that I was afraid of that I'm going to miss out on the lack of patient contact. But when I realized what a pathologist's role is in the overall management of the patient and what we can do to help patients, it's very gratifying.
Well, you certainly have made yourself a great career, and been of enormous help to many trainees, many students, and obviously many thousands of patients as you've worked day after day in the various areas of your expertise and so forth. And I'm sure there's much good still yet to come as we look forward to that. So Sanam, thank you so much for taking the time to talk today, and we'll wrap it up here. And